Hello. So I'll come in, gonna wash my hands. Hi, my name is Bree Tice. I'm a physical therapy assistant student. Can I get your name and date of birth?
Caleb Stanley, June 9th, 95.
Okay, all right, so that checks out. So today what we're going to be doing is going to be some screening, which is going to assess your neck and your arms. It's basically just to check and see that if you have any pain, any numbness, tingling, or weakness. Okay? All right, so what we're going to start with, do I have consent to continue?
Yes.
Okay, cool. All right, so I'm gonna make sure that I have you draped. I'm gonna drape you, okay, and you're in the position you need to be in for me to do your screening. So what we're gonna start with is gonna be just your neck, assessing your neck. So I'll have you do some motions, and then I'll have you hold it, and then I'll give you extra pressure, just to get you into that passive range of motion, okay? Okay, so what I want you to do is neck flexion. So it's gonna be the motion where you bring your chin down to your chest, hold it, and then I'll push you down a little further, okay? Okay, so I'll push you down a little further, like so. All right, so that normal range for that is going to be 80 to 90. So that'll be normal range. So if you have that range, that'll be great. The next thing we're gonna do is extension. So neck extension, you're gonna come, look up towards the ceiling, come back, and then hold it for me. Okay, and I'll give you some extra pressure with that. Okay, so that normal range for that is going to be 70. All right, and then the next one we're gonna do is going to be rotation. So you're gonna do right and left rotation. So it's gonna be this motion here, and I want you to hold it, and I'll give you some extra pressure. So go ahead and look over to your right side, okay? And I'll give you extra pressure like that. Normal range is 70 to 90. So go ahead and go to your left side, okay? Extra pressure, okay? 70 to 90 on that side. Next one we're gonna do is going to be side bending. So you're gonna bring your right ear to your right shoulder as far as you can go, okay? And then I'll go ahead and give you extra pressure. And for those ranges, it's 20 to 45. Go ahead and do your left side, okay? And give you some extra pressure for that, like so. All right. And then, so now that we got that all taken care of, you look like you're normal for that. You don't have any pain or anything with those. Now we're going to assess your arms, your shoulders. So basically, what I want you to do is have your arms hanging down to the side for me. And then I'm going to have you come directly up in front of you and reach up towards the ceiling and hold it there for me. Okay, and that'll be active. If you're passive, I'll give you a little extra pressure here. That's going to be full range, but that'll be 180. Next, we're going to do extension, which is going to be going back out to behind you, reaching back behind you. Okay. All right, let me get back there. Okay, and now go ahead and do it. All right, so extra pressure there. And with extension, the ranges is going to be 45 to 60, so that'd be normal range. Okay, and now the next one we're going to do is going to be your internal, external rotations. So what I want you to do is put your arms up into 90, elbows into 90 degrees, like that. And I'll just start with this one here. If you want to relax that one, that's fine. I'll hold this here. I want you to go ahead and internal rotate, so bring it downward and back, down and back, as far as you can go. Okay, I'll give you some pressure there. That'll be 70 for the normal range. Go ahead and bring it up and backwards, up and back. That'll be external rotation. Give it a little pressure there. That'll be 90. The normal range. Okay, so from this side. All right, so go ahead and go down and back for me, internal rotate. Okay, pressure there is going to be 70 for full range, a normal, and then go ahead and go up and backwards for me. That's external rotation. That'll be 90 for normal range for that. Okay. All right, so now that we assess those, looks like everything is good. You have normal range for those. Next thing we're going to do is going to be your myotones. So myotones is going to be testing your muscles and see your strength in your muscles, okay? So first thing we're going to do is bring your chin down to your chest again, and I'm going to, don't let me push you back, okay? So that'll be C1, C2. Do you feel any pain, any numbness, tingling with that? No? All right, so next I want you to bring your right ear down to your right shoulder. Okay, don't let me push you out this way, back away from your ear, back away from your shoulder, I'm sorry. So that will be C3, is what we're testing in the muscle, things like that. The next thing we're gonna do is going to be C4, so you'll want you to lift your shoulders up towards your ears and don't let me push you down. That's C4, okay? Next one's gonna be C5, and that's gonna be your, deltoid, so I wanna have you, once again, just abduct, bring your shoulders out and hold it there, don't let me push you down, okay? That's C5. Okay, any pain, anything there? No? Alright, the next thing we're gonna be doing is going to be your C6. C6 is going to be, I want you to flex your elbows up, so it's gonna be that motion, so go ahead and bring them down for me again, bring them down, okay, go ahead and flex up, okay, don't let me pull you down, okay, so that'll be C6. C7 is gonna be your wrist, and we want you to flex your wrist up, okay, don't let me push you down. You feel anything, any pain, notice, tingling, okay? All right, the next thing we're gonna do is gonna be your C8. C8 is going to be your thumbs. So I want you to bring your palms up in the air, and we want you to start with your thumbs across, alongside your palm, and then go ahead and bring it out, extend it out, okay? And don't let me pull you in, okay? But those seems pretty strong, pretty good. No pain, anything with that, okay? And flip your palms down. We're gonna be doing T1. T1, I want you to extend your fingers out. You're gonna abduct your fingers, and I'm gonna try to bring you in. Don't let me bring you in, okay? No pain with that, no numbness feeling, okay? Good. So everything seems like it'll be fine on your myotones. Next thing we're gonna do is gonna be your dermatones, okay? So with dermatones, we're gonna be testing your nerve roots and nerve endings, kind of seeing if you feel me touching you in certain areas. So just let me know if you feel any pain, numbness, or tingling with this testing. Okay?
Okay.
So we're gonna start with C1. C1 is gonna be so C1 is gonna be your vertex of your skull. So do you feel me touching you here?
Mm-hmm.
Okay, so that's C1. C2 is going to be your forehead, your temple, and your occiput. So it's going to be around here. You feel me touching you along there. Okay. C3 is going to be your neck. So if you feel me touching your entire neck, your under your mandible, and your posterior jaw, your temple. So you feel me touch you in those areas there. Okay. You don't have any pain, numbness, tingling. Okay. Cool. Okay, so the next thing we're gonna do is C4. C4 is gonna be just make sure you feel me touching you. It's gonna be on your clavicle, your upper part of your scapula, and your shoulder. So you feel me touching in those areas there. Okay, that's C4. C5 is gonna be your deltoid. So it'll be your deltoids here, your anterior part of your arm, and down to your base of your thumb. So you feel me touching you in those areas. Okay. All right, now we have C6. C6 is going to go from the anterior part of your arm, and it's going to go down to your thumb, and then also get your index finger going alongside the radius, all there, so you feel me touching it?
Yep.
Okay. All right, now C7 is going to be, it's going to be your lateral side of your arm. So lateral side of your arm here, and it's going to go down to the index finger, the middle finger, and the ring finger. Okay, so that's that. And then the next thing we're going to do is we're going to do C8. C8 is going to be the lateral part of your arm, and it's going to go down to your pinky, and then also get your ring finger. So it's going to, you feel me touching you there?
Mm-hmm.
Okay. Next thing we're going to do is T1. T1 is going to be the lateral part of your forearm, and it's going to go down to the base of your pinky. So you feel me touching you all in that area?
Yeah.
Okay, cool. That seems like you have normal sensation there too. Okay, so now we got done with our dermatones actually. We're gonna do your reflexes. Reflexes, I'm gonna get my tool that I'm gonna use. And we're gonna do, let's see, so let's do your brachioradialis tendon. So we want to have you just relax your arm as much as you can. We want to have it stretch just a bit, and then so I'll be kind of tapping along the tendon of the brachioradial, and what you would normally see will be like a flicker of the arm as I'm doing this, and that'll be your C6. No, that'll be your C5 actually, and then This one, next one, we're gonna do is biceps, biceps tendon, so go ahead and just bring it in, kind of relax. And I should have a chair, actually, I should be in good body mechanics, it would be. So I will have a chair basically, and then I will be just kind of tapping right here for the tendon there, and as I tap, it will be a flicker of the whole arm there, and that's gonna be your that's gonna be your C5, okay? And then next one we're gonna do, last one we're gonna do is gonna be your triceps. Triceps, will be holding it back, having it relaxed, and then we're gonna kind of tap along the tendon on the triceps, and as I tap on here, there will be a flicker of the hand, and that will be your that will be your C7, so we'll be doing that, and that'll be what you'll get, okay? So, everything seems to, be fine, you don't have any pain. If you did, I will basically just focus in on those areas during the treatment, and just make sure you get stronger and get better mobilization, okay? Alright, so I'll see you next time.
Alright, sounds good.
Okay, cool,
Thank you.
see ya.